Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon and work in Merseyside, United Kingdom. I see a lot of older adults who have arthritic pain, and unfortunately some of them become so weak, the muscles become so weak that they have difficulty mobilizing. How can we exercise and make this muscle stronger? Now, if you go to the gym and work out for an hour, it becomes very difficult because you need to exercise the entire hour. The trick in doing exercise is to do little but often. Short spurts and repeat those short spurts. That way, you're not getting tired and you can get the right exercises for the muscles. Now, weight bearing or using weights and doing exercise is very important as one goes old. Because by weight bearing, you're increasing the strength of the muscles, and in addition, the bones also become stronger. What I suggest is that there are 7 exercises I'm going to show you, 3 with the use of weights and 4 without the use of weights. And each exercise I want you to repeat 5 times. The 3 with weights will be done as a group, and the 4 without weights will be done as a group. Now, what I would like you to do is that do these one repetition of, or one set is 5 repetitions. Do one set of all these 7 exercises maybe 6 or 7 times a day. The best way to do it would be while you're watching television in the evening. Every time the adverts are on, do one set of all these 7 exercises. Adverts come maybe once in 15 minutes or once in 20 minutes or once in 30 minutes, you're doing one set. Say if the adverts come once in 15 minutes and you're doing 4 sets in an hour, and then in 3 hours from 5 o'clock to 8 o'clock, you are doing 12 sets. And in each set, you have done 5 repetitions, which means you're doing 60 repetitions in the course of the evening. That would make your muscle really strong and will help you with coping with the pain from arthritis. Strong muscles help to decrease the pain from arthritis. It is because the muscles become strong, stabilize the joint, there is no abnormal motion, and that is how exercise helps in joint pain or arthritic pain. So first I'm going to show you the 3 sets where you use ankle weights. You may need to purchase weights like this. They're available on Amazon, and you need to tie them around your ankle. Either you can tie them or you can get someone to help you with these weights. So I'm going to tie it on my ankle. Ideally, the weights should not be on your bare skin. You should either wear socks or some form of trouser so that the weights are not in direct contact with your skin and are over your clothes. So the first exercise is the quadriceps or the front knee strengthener. So we are going to strengthen these muscles. So I'm going to give 3 exercises, 5 each on each side. So starting with the right leg, 5, 4, 3, 2, 1. Swap the legs. 5, 4, 3, 2, 1. So that is the front knee strengthener. The next is the back knee strengthener, for which you need to stand. So you can stand, turn your chair to one side, so you're at the back of the chair. You can hold on to the chair for support, and now you're bending your knee backwards without making the knee come forward. So in this position, facing straight ahead, bending backwards, 5, 4, 3, 2, 1. Swapping the leg, 5, 4, 3, 2, 1. That is the second exercise, or the back knee or the back thigh strengthener. Next, you want to do the hip strengthener or the gluteus medius strengthener. So I will show you by turning the other way, and you're strengthening these muscles. So you want to lift your legs sideways and see that your feet are pointing forwards as you do that. 5, 4, 3, 2, 1. Swapping to the other side. 5, 4, 3, 2, 1. So those are the 3 exercises using weights. When you do 5 repetitions of each of those is 1 set. So we have done 1 set of those 3 exercises. So imagine if you're doing just these exercises, forget the rest 4, and if you do it every 15 minutes when the adverts are on, you're doing 60 repetitions in 3 hours' time. Your muscles will become stronger and they'll be able to support you. I'm going to show you the second set, and there are 4 exercises. And it's important that you do only 5 at a time, 5 repetitions at a time, and not more. Because if you do more, it'll hurt you. Little but often is the trick on how to build up the muscles. So the next set of exercises don't need the weight. So I'm going to place it by the side. And they are going to help us from sitting and standing. One of the things that I observe in older adults who come and see me is that they lose their ability to sit and stand. So sitting and standing becomes difficult, and they have to use the support of the chair. If you do these exercises regularly, and if you have lost that ability, it is possible that you will regain the ability as long as you continue to exercise as I have suggested. So what are the 4 exercises, the next set? So 1 is sit-stand. That is the first exercise. I'll do that in a minute. The second exercise, you have to stand at the back of the chair and tiptoe and down. The third exercise is you don't sit and stand, you do a half sit. That is, you come to the front of the chair and you're sitting only a little bit. Because the difficulty older adults have is that going down and coming up becomes difficult. But if we build up muscles up, then slowly it can get better. So even if your muscles are weak, you should be able to do this movement. So if you start off like this 5 repetitions, in 2 weeks' time, you may be able to do this. In 4 weeks' time, you may be able to do this. In 8 weeks' time, you may be able to do this. And in maybe 12 weeks' time, you'll be able to do this. So that is how you build up the muscles. And the third exercise is lifting the front of your foot upwards, like this. And then you repeat the 4. So I'll do all the 4 so you will see what I'm doing. So the first one is you sit and stand. So 5 repetitions of the sit and stand. So you start by sitting. 5, 4, 3, 2, 1. Then come to the back of the chair, hold on to the back of the chair and tiptoe 5 times. 5, 4, 3, 2, 1. Then come to the front of the chair, and now you're only doing the knee bends without sitting and standing. So initially it can be only this. As you progress, it can be this. This, you're trying to place the bum into your chair, but you're not sitting down. So 5, 4, 3, 2, 1. And the fourth exercise is you come to the back, and now you stand on your heels and lift the front of the foot up. 5, 4, 3, 2, 1. So those were the second set that you need to do without the weights. They were sit stand, tiptoe, knee bends, and heel, lifting the front of the foot up. So those again become 5 is a set, 5 repetitions a set. And if you can do 6 sets in the evening, every 15 minutes while you're watching TV and when the adverts are on, you've done 60 repetitions. That will make your muscles strong and will decrease your pain from arthritis. Thank you very much for listening. Share this with any older adult that you have. In addition, if you want to buy, I have written books for older adults on how to do these exercises. The link for those books are provided on this QR code. And also there is a separate book on lifestyle medicine and how you can use lifestyle medicine measures to improve your strength and to decrease the pain from arthritis. Thank you so much for listening. Bye-bye.